So let's go ahead and look at another case of when the ANA panel is misinterpreted. So this is a 42-year-old female, tiredness, fatigue, a little bit of joint pain, but a lot of just kind of low-grade, long-term GI issues. Just doesn't have, normal bowel movements, things like that. And then went to the doctor, got a workup, couldn't find anything, said everything was normal, so she really insisted to go see a specialist. So they thought, okay, well, you have a family history of autoimmune stuff, so let's just send you there. And it came back with a weak positive on the ANA. And because this test is misunderstood so much, they basically said, okay, you have lupus. Now, that's a big word to throw around because lupus is a very, very serious condition. And now remember, when we're talking about females in their 40s, 50s, 60s, it's not too common that a lupus will just show up out of nowhere. As well as you being able to relatively operate fairly normal, where did it come from? There are several mechanisms. GI is a notorious one. Several different aspects of the GI, whether that's happened in the small intestine or the Peyer's patches or a molecular mimicry or a dysbiosis type problem. But that can lead into essentially sending your immune system on a wild goose chase. So let's look at these numbers and let's see again what happened when you start looking at the bigger picture of what can cause some of these autoimmune panels to flare. So here's the first test. Homogeneous, which is generally considered to be heavily associated with lupus. However, you notice how this test isn't bold. Now, LabCorp or different Quest or like different laboratories, they will bold certain like positive. This is a bad test. Why didn't they do it for this? Because if you've watched some of our other videos, you'll notice that if it's a 160 pattern or a 320 pattern, they'll be bold. Well, technically, if your pattern is less than 1 over 160, so if it's 1 to 80 or 1 to 40, most of the time that is considered a false positive. However, doctors look at that and they say, oh yeah, you definitely got an autoimmune. And don't necessarily. GI conditions are known quite rampantly and regularly will cause these type of issues. Certain viral infections can as well. And heck, a really crazy weekend in Cabo or something like that can cause it as well. Well, guess what happened 3 months later after we started working on some of the GI factors that we found that were heavily associated with her? Bye-bye. There it goes. So again, when you look at these screening panels and your doctor's saying you have these really horrible conditions, you have to start asking the questions of why did this just start randomly showing up in my 40s or my 50s and causing generic weird pain all over? So again, if you're 40s, 50s, 60s, and your doctor decided to randomly tell you that I think you have an autoimmune condition, and you're like, where did this come from? I've had my kids, I've had my career, I've gone through stuff, and all of a sudden this hits, and what's the classic answer? Well, I don't know, it was probably menopause. Or was it the fact that you have several different things in your body making your immune system angry, causing cross-reactivity? Do you have poor mucosal membranes? Do you have an overactive Peyer patch sensitization? Do you have a dysbiotic biome where you're having opportunistic commensal species grow up that are going to trick your immune system into attacking your own tissue? There are so many other factors that play into it of why your immune system would get sensitized and ramped up into this self-destructive pattern. This is not to say this is all autoimmune conditions. But it's really nice for the females that we work with that take a look at these tests and realize, I wonder where it came from and if there's anything I can do about it. Well, a lot of the times there is, even with those hardcore cases that you've had lupus since you were 12 years old. Okay, there's the cases of what can we do to decrease the number of variables your immune system's trying to work with. Please reach out, DM, connect with us on social media, Instagram, Facebook, here on TikTok. Let us know in any way if you want to look a little deeper and start discovering some of the other things that are contributing to why your panels are coming up positive and why you're not feeling well, even though you're on medication and you've tried the standard approach and it's just not working.